my name is Rachel Simpson and I'm going to tell you about the yellow fever virus. The yellow fever virus is a member of the family of the Flavaridae and of the genus Flavivirus. They are usually transmitted by mosquitoes or ticks. Specifically, the yellow fever virus is transmitted through the bite of an infected Aedes aegypti or homogamous species mosquito. These are examples of the two most common mosquitoes that transmit the virus. You have the Aedes aegypti on the left, and you have the homogamous species on the right. The yellow fever virus is a positive single-stranded envelope RNA genome coding for a polyprotein and is similar to the more commonly known West Nile virus. The structure of the yellow fever virus differs in that of organisms of the same species and that the sequence of the amino acids is different, it lacks an amino acid in the BC loop, and it also has a predisposition for the liver, whereas other viruses of this flavivirus are susceptible to the brain. This is a common structure of a flavivirus. There are rare cases of illnesses reported in the United States. Most of the population affected is going to be in South America and America, where there is an estimated 900 people at risk. Mosquitoes thrive in warm, moist, humid climates. Therefore, the risk is increased during the months of high rainfall and high temperatures, in the rainy season, and early into the dry season where it's most humid. There are more densely populated and unvaccinated an area is, the more at risk for a large epidemic of the virus. Here is Africa on the left and South America on the right. These are the two most common regions affected by the yellow fever virus. Here we are talking about the transmission. Again, it's spread by mosquito bites of an infected primate. It is then further passed on to potential hosts. There are three different types of transmission cycles. You have the jungle cycle, savanna cycle, and the urban cycle. You see you have your primate right here, your mosquito vector here, and a human host here. First, you have the jungle cycle. It's also known as the salviatic cycle, and it's the spreading of a virus from a mosquito to a non-human primate, which is then bitten by another mosquito and passed on to a non-human primate. It also could be spread to a human in the area. Next is the savanna cycle, or the intermediate cycle. This is transmission of a virus by a mosquito, either to a non-human or human primate. Then that non-human or human primate is bitten by a mosquito. It is passed again either to a human or to another non-human primate. This is common in Africa only, and this is due to the separate villages around the borders of the jungle. Last is the urban cycle. It's the spread of the virus from an infected person to a mosquito. The mosquito then bites another human and then is then just circled into the cycle. Once there are symptoms that are affected with the yellow fever virus, most people display little to no symptoms and may develop symptoms 3 to 6 days after exposure. Some cases, symptoms are not specific enough to diagnose and people are left undiagnosed. There are 3 phases of infection: invasion, remission, and intoxication phase. Invasion phase include mild symptoms: fever, headache, fatigue, body aches, nausea, vomiting, weakness. After experiencing the symptoms, they usually reside in 3 or 4 days. If the person continues to have the disease, they might go into remission phase, where the symptoms seem to improve, which may last for a few hours or a few days. If symptoms do not improve, then you go into the intoxication phase, which only affects 15% of yellow fever virus patients and numerous body systems. Stage can last from 3 to 9 days and has 3 main symptoms, which includes vomiting blood, inability to secrete albumin in the urine, Also jaundice, which is yellowing of the skin. That is where yellow fever term is from, the yellowing of the skin. Intoxication phase could continue to progress into delirium, coma, and eventually death. According to the Center for Disease Control, 20 to 50% of those who enter the intoxication phase die, but those who survive generally have lasting immunity for recurring infections. This is just a general overview of the symptoms associated with the yellow fever virus. Diagnosing yellow fever virus. TEST works by isolating the virus, demonstrating the viral antigen or specific antibody response. The virus remains detectable in the serum for up to 14 days after exposure, but is best results if received within the first 4 days. Some diagnostic testing include PCR, which allows for microbiologists to produce a large number of identical DNA molecules to detect the viral. The ELISA test uses an enzyme protein to evaluate the immune system and immune responses in the body. The yellow fever can also be diagnosed using an indirect fluorescent antibody test. Uses a fluorescent microscope to observe antigen in the sample. Another test is HICF and other neutralization tests, which test for the presence of antibodies. More tests are able to perform after an autopsy is complete. Treatment. There's no specific treatments. It's best to initiate bed rest and fluids to prevent dehydration and further fatigue. Pain relievers should be used to treat fever or pain. NSAIDs and aspirin should be avoided to prevent higher risk of bleeding. After 5 days, the yellow fever virus will be unavailable to infected vectors. Therefore, the infected person should remain indoors for at least 5 days to reduce the risk of exposure to other vectors. Other ways to prevent yellow fever, since there is no treatment, is proper insect repellent, proper clothing, knowing peak biting hours, and to get vaccine. Proper insect repellent contains DEET, Picardian, IR 3535, or oil of lemon eucalyptus. Cooter, Off, all those common brands are good to use. Weather allowing, wear long sleeves and pants to cover the skin, and also spray the clothing as well to prevent bites. Know that the greatest biting time for most mosquitoes is from dusk to dawn, although the Aedes aegypti species is more prone to feeding during the daytime. You need to know potential mosquito breeding areas and how to eliminate. Throw away old bottles and cans. Clean overgrown fish ponds. Clean clogged gutters. Repair leaky faucets. Empty water from pool dishes. Change water or baths every week. And to fill tree holes. Last but not least, a sure way to prevent yellow fever virus is to get vaccinated. For most effectiveness, vaccines should be given 10 days and traveling to a known country susceptible of the yellow fever virus. Most countries require a vaccination or a booster titer before traveling to the country. You can check on the CDC website for details. It's not recommended for infants younger than 9 months, pregnant women, hypersensitive to eggs, or those who are already immunocompromised. In conclusion, yellow fever virus is a viral disease prominent in South America and Africa. It causes transmitted between Aedes and homogeneous species mosquitoes. Treatment is not available, therefore prevention is encouraged. Prevention can be included in vaccination, skin repellent covering the skin, and remove potential breeding sites. Thank you.